This two-part episode features me as the interviewee. I'm being interviewed by Kristen Hovet, the host of the Other Autism Podcast. I hope you enjoy this conversation, and later this spring, I'll have the opportunity to have her on my podcast to share her story.
Today, I'm speaking with Dr. Michael Lenz, a physician specializing in pediatrics, internal medicine, and lifestyle medicine. Dr. Lenz is based in Wisconsin and is the author of the book titled Conquering Your Fibromyalgia, and he's the host of the podcast by the same name. Please say hello to Dr. Michael Lenz.
My name is Dr. Michael Lenz. I am a physician. I wear a lot of different doctor hats. I'm a pediatrician. I'm also boarded as an internal medicine doctor, got lifestyle medicine as well as lipidology. And I had a doctor in pre-med period said that every 7 years, half of what you learn changes. And I took that to heart and I wanted to be a lifelong learner. I wanted to learn things in depth and I didn't want to focus on just one organ system in med school and I didn't want to do surgery. I always had a big heart for mental health and related issues. And I went into medical school not believing hypochondria was real. I just didn't quite understand what it was. And I had to learn more among the fire hose of information we have to learn as doctors. And I'm married, and I have my wife who's a dietitian who teaches people about eating healthy and loves what she does. And I have 3 children, a son and 2 daughters who are in college and one at the senior in high school. And I practice in southeastern Wisconsin, and I see both general primary care, so from newborns through retirement and ages in between. I see lots of families, and when it comes to neurodivergency, from nuclear to even to extended families, because it's often hard for somebody who is neurodivergent to find a doctor who understands, can provide good support and care. So often I get referrals within families and then friends. And as we can talk more about this, I also have a special interest in chronic pain syndromes, often known as these invisible illnesses that are very challenging. My favorite group of patients actually are working with people who are struggling with these chronic invisible illnesses. Fibromyalgia is the epitome, but under that umbrella are things like EDS, POTS, mast cell activation, chronic fatigue syndrome, migraines, IBS, irritable bowel, the list goes on. The depth of suffering is deep. And the area or the time of suffering is profound. And when you can help somebody, it's one of the most rewarding things you can do, to help somebody live better with a evidence-based approach.
So a lot of your work, as you said, is focused on chronic pain syndromes. I think many listeners are at least somewhat familiar with the concept of chronic pain, but can you explain what is meant by chronic pain syndromes?
There are 3 types of pain. So I'm going to use a technical word. It's called nociceptive pain. That's one type. And this is in the last 2 years, the International Association of Pain, I forget the whole acronym, has come up with these 3 categories of pain. So nociceptive is what we think of as classic pain. In fact, a lot of people assume there is only one type of pain, and that's tissue damage. So if you think of an appendicitis, a bone fracture, ischemia in the heart when somebody's having a heart attack because the blood flow is not getting there, there's tissue damage occurring, right? So we get that concept. Neuropathic has to do with an injury to the peripheral nerves. The most common cause of this is diabetic neuropathy, so uncontrolled diabetes. The glucose has a chemical reaction with the coating of these nerves, causing abnormal signaling and firing and giving pain from that. And another common source is under neuropathic would be a herniated disc that's compressing that nerve. When we come to chronic pain, the category is called nociplastic pain. That's pain that's been going on for 3 months, but it's not just pain. There's fatigue associated with it, there's insomnia associated with it, and there's cognitive dysfunction or struggles, also known as brain fog. When we look at a simple definition that I'll talk about, when we think of anxiety and pain as definitions are like a fever. In itself, it's not very helpful because if you don't know the context. But anxiety is the perception of a real or perceived threat. And pain is the perception of a real or perceived tissue damage. We get into trouble or misunderstanding as doctors may not know these 3 types of categories exist, and patients often don't know these categories exist. for many people, when they have these nociplastic pains, there is this perception of a tissue damage when there isn't the tissue damage. Or if there is tissue damage, the perception of tissue damage or injury is higher than the actual injury. That doesn't mean there isn't any less distress. That doesn't mean somebody who is experiencing anxiety is not in severe distress, but they are in a safe area, per se. If we're talking about anxiety, there isn't an immediate threat, but there's a sense of an immediate threat. And it feels the same.
I was just thinking, you mentioned hypochondria. So I'm sure that people experiencing that third type of pain would often be labeled with that because
Yes.
people wouldn't understand where it's coming from.
And like a patient I saw today, she had been seeing specialists for decades, even went to the Mayo Clinic, and nobody has given her the comprehensive help that she needs. Often people, when there's complications, they'll see a specialist. They might see an allergist for mast cell, but the allergist doesn't see the whole person necessarily in general sense. Or the GI doctor may see somebody for an irritable bowel syndrome, but their expertise isn't so much past that. They may then defer to a psychologist who's not the expert in the migraines, but the neurologist is an expert in migraines, but they may not be the expert in another area. So when we talk about some of the science that really makes fibromyalgia a real problem was functional MRI testing by Dr. Daniel Claw, published around 2002, where they looked at people with fibromyalgia and people without fibromyalgia. And they applied pressure gradually to the thumbnail, and they could measure the amount of pressure with a special pain meter. And they said, tell us when you are in moderate amount of pain. And what they found is those with fibromyalgia reported pain at about half the amount of pressure as those without. When they looked at blood flow or activation in parts of the brain, they found that the same parts of the brain were activated in both groups, but it was just at the lower threshold. So the experience of distress was, this is real, this is legitimate. And before that, they thought it was like a psychological phenomenon. It's like imagining things.
That's really interesting. And how does the mast cell activation fit in with fibromyalgia specifically?
It falls under the umbrella of nociplastic pain. And when you look at symptoms, often there is going to be fatigue, brain fog, insomnia, and pain associated with it. And then there is often other neurological endpoints where there can be rashes or hives or intestinal diarrhea or flushing or GI symptoms, often with an underlying stressor that activates and the body reacts, that hyper-responsive nervous system, and is reacting to the perception of a threat. And a lot of these are reflexive without any conscious effort. I think more research on this isn't just a mast cell that's overactive, but it's probably the central nervous system sending a signal to tell those mast cells to react. Is there anything wrong with mast cells? No. Just like when they do muscle biopsies of people with fibromyalgia, there's no difference in the muscle itself, but the central nervous system, the brain, brainstem, and spinal cord are reacting.
And what inspired you to become interested in these conditions, especially in relation to neurodivergent populations?
Even before medical school, I remember people in extended family who might not show up for a 4th of July gathering. As a child, I remember asking my mom, oh, why is so-and-so, the wife, not here, that man? Oh, she's got agoraphobia. She doesn't really leave the house much, which was always a mystery. Like, why wouldn't somebody leave the house? What's agoraphobia? They're afraid of outdoors, which didn't make sense. I always had that curiosity. And there were extended family members who were struggling with mental health, but that was a mysterious thing in the 80s. My first year in med school in the fall, we had an optional lunch lecture on ADHD. I think it was by Russell Barkley, because he, I think, was in Milwaukee at the time, but we had so much information. And if you are in the ADHD world, Russell Barkley is one of the internationally recognized experts. And I heard about this thing called ADHD, and I didn't quite get it, but I knew that this was being described as a real phenomenon. And my first year in med school, we had to pick a health illness in our gross anatomy group. Every 4 people, you had a little group, and it was divided in the alphabet every 4. So our gross anatomy group also was our small group on problem-based learning, and we had to pick a health condition, and what we would understand is that biopsychosocial understanding of it. Our group picked depression, and our mentor was one of the attendings in psychiatry. And we learned 20% of people will go through depression during their lifetime. This is as common as high blood pressure. And so that mental health awareness, this impacts healthcare, right? In so many health issues. So I had that. Plus, again, we are learning so many other organ systems, every way the body is supposed to work properly and all the things that can go wrong. So I carried that into medical residency with an understanding that mental health has an impact, and had training in ADHD when I was doing pediatrics. My clinic was a routine, just like taking care of an adult with high blood pressure or asthma. We were diagnosing and treating kids with ADHD. At the time in the 90s, they thought miraculously it would go away at age 18. Only a few adults continued to have ADHD into adulthood. That was the recognition back then. And girls and women don't really get it, or probably didn't get it. That never made any sense to me. And I kept remembering my mentor who said every 7 years, what you learned in medicine is going to change. So you always have to be humble to learn more. So in isolation along the way, I'd learn about migraines. I'd learn about IBS. I'd learn about this central pain sensitization, vague syndrome, and disordered fibromyalgia. And I've heard about these kinds of problems. And then you start taking care of patients. And then over time, you start to see trends. There's a family history of these central sensitivities. You might have migraines. Your mom had a chronic arthritis. But the weird part is your mom's chronic arthritis started in her 40s, which is really unusual. But it turns out that's what they called fibromyalgia back then. When they didn't want to call it fibro, they said, you have arthritis, but they weren't having crippling arthritis. So you start seeing these patterns. And again, I didn't believe in hypochondria. And now I had a big heart for caring for people who were struggling, and you start seeing these other connections. And then a lot of my patients who had these chronic health illnesses, like these invisible illnesses, also had coexisting or co-occurring ADHD. And you'd say, we have ADHD. Dr. Lenz, since my ADHD is getting treated, my pain isn't as bad. That's interesting. And you start looking what other studies are coming out. And then in the 2010s, you start seeing some studies out there and case reports that this isn't just my observation. Other people are seeing this as well. And I wrote a book that got published just over 4 years ago. Do you know how many times I mentioned the word autistic or autism? 0. I had an understanding of autism as a pediatrician who is looking at autism as something you screen for if a child is delayed in talking, is having dysfunction in the stereotypical educational standpoint, usually a child. And most of now what we often have the stereotype. That's why I like your podcast, The Other Autism, but there's that stereotype. The other part, and I love that you talked about this on your podcast, is I read the book Highly Sensitive Persons, or HSPs, right? Highly Sensitive Persons or People, right? By, who's the author again? I forget off the top of my head.
Dr. Elaine Aron.
Yes. I remember reading it and I go, oh, she's talking about my fibromyalgia patients. This is weird. And I emailed her and I said, I'd love to talk to you more about this. Like you, I never heard back. But then I started learning more about autism. And probably about 3.5 years ago, I had a patient who was treating for fibromyalgia. And she said, Dr. Lenz, I got diagnosed also with being autistic. And I wasn't going to say, no, you're not autistic. You looked at me in the eyes. So I just go, that's interesting. I won't deny this diagnosis by a psychologist, but it doesn't fit my understanding of this. And it turns out there's a lot of people who have these co-occurring conditions. And once you learn a little bit, then you see the connections with your patients. And then you ask your patients about some of these. I ask my patients and they share these experiences. And the more I recognize this, I'm like, wow, this is a huge part. And it's not my perception. Then you look at what is the research showing. It is also being shown that these are often very co-occurring, and often many people who have autistic style way of experiencing the world have been through a lot of struggles and have been misunderstood. And for the first time in their life, they have somebody helping explain a lot of the struggles and then helping support them. Like a similar patient of mine today, as we start asking some of these questions to help understand themselves better. It's about time we get the right support and care for them. And I think part of understanding if somebody is autistic, that can impact overlapping with autistic burnout, which can overlap with fibromyalgia flares. And if we start understanding from the biopsychosocial, spiritual, environmental aspect, starts to make sense. Instead of random flare-ups, you can start to see how these other factors connect when we look at it from this more complex understanding.
Thank you. No, that's really interesting. And I don't mind sharing. I recently had an emergency situation where I reacted to something that I took, and it appeared to the people, the emergency personnel, that I was having a panic attack. And it was likely related to my mast cell activation. And even like it was more like an anaphylactoid kind of reaction. And I had like chest pressure, everything. And my speaking like ability just went out the window. And so they assumed I was having a panic attack. And I was able to tell them, like, I have mast cell activation. I'm having a reaction. And they're just like, they saw that I was autistic, and they're like, oh, you're autistic. We totally understand what's going on here. And I'm like, oh, and I couldn't express myself. And I was just speaking in one word. My cat was behind them. So I was like, cat. And they just thought I was like being an autistic person. I'm like, no, seriously. Usually you cannot tell that I'm autistic. And I was trying to articulate that. And they're just like, we know what's going on. You're having a panic attack. So it's like this education is so needed out there.
Yeah. I think it can be helpful in helping somebody, if you're autistic, put that into the bigger sense of things. One analogy I like to use in talking about fibromyalgia and a lot of these invisible illnesses is it's like being blindfold, bound, and tortured by an unknown assailant without any recourse for relief. And it feels like there's no hope. You don't know how you got kidnapped. You don't know how you're in this situation. It wasn't on your own accord. And you have faint ideas. You may hear footsteps going up and down stairs, and it seems random. But through education and understanding, taking off the blindfold, it can be like, oh, there might be someone, let's say, who has fibromyalgia, discovers they have co-occurring autism and ADHD with co-occurring restless leg syndrome, who has had trauma and stress in their life. And they go to school and they like numbers and finances and things. And then they discover that they have to do sales as part of their personal finance and retirement planning, which means you have to go and make small talk with strangers. Oh, didn't know that was going to be part of the job. And now it's very stressful. And then there's quotas, and you have 6 months to get this clientele up. But it might be, wow, what if you got a job where you didn't have to Zoom, you didn't have to do face-to-face, you can support people on the phone, through email, text, and support their retirement. And that understanding can be like, oh, I have to find the right fit. When you have a patient like that and they then get the job, they start feeling so much better about themselves, and they can function better and hopefully have less stress about a job that is a bad match for their neurotype.
In your experience, how do sensory processing differences in autistic and other neurodivergent individuals complicate the diagnosis of fibromyalgia or other chronic pain conditions?
It's part of that. In fact, when you look at the Fibromyalgia Impact Questionnaire revised, one of the questions is, these are like 0 to 10. It's a functional score. It's one of my early podcasts is, how bad is my fibromyalgia? And it's a tool I use if I was seeing somebody. I do the widespread pain index, symptom severity score for diagnosing, along with the careful history. If somebody lost 27 pounds with bloody stools, I'm going to wonder if they have ulcerative colitis or cancer and not assume they have just an IBS and they're stressed. You could have metastatic breast cancer and you have pain everywhere, and we're going to do a careful history to rule that out. But with that, making a diagnosis. But part of the Fibromyalgia Impact Questionnaire, there's 0 to 10. The last question is, how sensitive are you? From not at all, 0 to 10 being very sensitive to things like light, smell, touch, temperature, sound. I'd been doing that for years, and many fibromyalgia people report, I'm very sensitive. I can't stand sudden noises or changes or these sounds. And often what we're describing is the same people who are autistic as who have fibromyalgia. These are overlapping. And when you look at these overlapping Venn diagrams, it's, I've always been more sensitive to certain things. That's, when I say complicated, it makes, I think, not the diagnosis so complicated. I should say, what makes it complicated if somebody's autistic? They may not express in a doctor's visit, because of alexithymia, how their inner state of being is, with spoken words, right? And so that can be if you are picking up body language that you're being not validated, that they don't really trust that what you're saying is true. There's a lot of, especially by the time somebody sees me, they've been going on for years, if not decades, of being a multiple specialist, haven't quite given up hope because they're still looking, but they don't even know if they want to tell everybody there's something wrong. I'm giving a talk in 2 weeks at the Children's Hospital of Wisconsin Autism Clinic for the clinicians working there, talking about chronic pain and autism and ADHD and the overlap. And one of the cases I share is a patient who came in to see me. She was in college, going just for a college physical. And before I walked into the room, I just asked my nurse, "Oh, any concerns?" And the nurse said, "Nope, she's just here for a physical, no concerns." And then I walk in, and there she is. Nice, doesn't look any distress, looks healthy, like a nice invisible, somebody with an invisible illness, right? So in our computer system, we have medical records, and there's a problem list. She was new to me, used to see a pediatrician, and I see this problem called dysmenorrhea in the problem list. And sometimes there's things that says broken arm or strep throat or UTI, and I go, "Oh, is that still a thing?" And she's, "Yeah." I'm like, "Oh, like from 0, not at all a problem, to 10 being extremely uncomfortable. How bad is the pain with your periods?" And she started to say it's like a 15. It's so bad I can't go to school for a couple days. And I said, "I'm just curious, why didn't you tell the nurse or me when you made the appointment that you were having this?" She's, "Dr. Lenz, I've been having pain since year after getting my period. I went to the pediatrician. They gave me ibuprofen. It didn't help. I went to an OBGYN, and she said, all I can give you is birth control. And that didn't help." And I said, a lot of people who have pain with their periods also hurt other places in their body. They might get migraines, neck pain, other places. And then she started to cry, and she said, "Dr. Lenz, I hurt everywhere. I've hurt everywhere since I was a kid." And I said, "Well, why didn't you tell me?" She said, "Because nobody ever did anything for me. And I think my mom, I don't even know if she believes me. And no doctor's been able to help, so I just learned to stop complaining." I started talking to her, and I said, "Well, it turns out a lot of people who have these kind of problems also have some co-occurring things, like problems with restless leg or periodic limb movement disorder. They might have ADHD. They might have an autistic-style brain and nervous system." Fast forward, she said, "Yes, my legs are uncomfortable. I can't lay still at night. It's hard for me to, I always have to be stretching and moving." I said, "That's a medical condition. How long did you have that for?" "Oh, I've always had this since I was probably in elementary school." And I said, "Did you tell anybody about it?" "No, it's just my mom said that's growing pains." I said, "That's actually a condition now we understand it's a medical condition called restless leg." Made sure she wasn't anemic, treated her with medication, gabapentin. She slept through the night, did the evaluation for ADHD, and that she was treated with Vyvanse. And we also did the CAT-Q and the RADS questionnaire. We talked about autism, reading the book, Is It Autism and Other Factors? And she said, "Yeah, that makes sense, being autistic." She also was having migraines. And she said, within a month of adjusting doses, she said, this is the first time in her entire life she had no pain with her period at all. A year later, her sister came in, who was in high school, and said, "You need to see Dr. Lenz." Finally, they came in, and she was having some of those early kind of things. So I think part of what complicates it, and often it might be as gaslighting or minimizing symptoms, and often people will learn, well, I know, I guess you just don't complain, because you can sense that. And many times if you're in childhood, the pediatrician, this is not in their experience. They don't know how to manage this. They refer to specialists. That specialists can't figure it out, and you get ping-ponged around and nobody gets answers. So
That really resonates actually with my experience. And the other part of that is I too remember going to the doctor when I was little and having, I think, growing pains that were way more than they probably should have been. And that was the start of things for me in terms of being gaslighted by physicians and others in the medical community. But the other element of that was my mom and I have very similar conditions and bodies. And who does a girl go to when she has questions? Her mom. And so for her, those things were normal. So it was, oh, that's just what happens when XYZ. So for me, it was, I didn't realize that what I was experiencing was not the norm for the longest time. Like it took me until probably high school and talking with my friends about these things. It was like, no, actually, yeah, I don't experience that. Oh, okay, interesting. So that was like part of my journey. But yeah, it's amazing. I can't even imagine how it would feel to go to a doctor and feel that validated. Like really, it's a constant, every time I have to go to the doctor, I'm filled with anxiety because it's, like, oh, I have to walk through all the things again, make sure I don't seem too hypochondriac or too needy or too extra. And also there, I had cancer in 2015, and that was a whole thing. And I talked about it a bit with my last guest, Dr. Paula Holmes-Rodman. Her sister passed away from cancer, and she was talking about the concept of the perfect patient. And so a lot of autistic women especially want to be the perfect patient, and it's probably because they've been so gaslighted over the years. So we'll tend to just be like, yes, and nod our head, and we're not really taking anything in, but we're nodding. So there's that too. And just wanting to show that we're going to do everything the doctor says, because we don't want them to think that we're, I don't know, that we're just not good patients, that we're not going to do what we're told. Or so
Part of that family, the mom did come in with their daughter who was in early high school, and talking with mom, she's, Dr. Lenz, I'm pretty sure I got the same type of brain. I didn't know any better. That's what I was told when I was younger. And so it wasn't because your mom or this patient's mom, this is a normal thing. And why, if you listen to my podcast, I do a lot of history on my podcast of what medical diagnoses that were likely, what we called fibromyalgia in the 1800s was neurasthenia. And that faded in the 1920s and 30s as a diagnosis you may have never heard of, because then we started getting into the classic biomedical model, like, oh, we can use a microscope and we can see bacteria and we can have x-rays and fractures and eventually get antibiotics and do surgeries and anesthesia. And who wants to waste time on these invisible illnesses anymore when we can do real medicine? And for about 80 years, it faded until now we have this rediscovered that, yes, this was a real problem. A lot of the doctors were onto it at a time. I had a recent patient say to me, who was referred by another patient, and a lot of times people hypothetically were in the same area and you go, you should see Dr. Lenz. Let's say you have somebody who has these invisible illnesses and you're like, I think you should check out Dr. Lenz. You're like, why? What makes him different? I don't know. I think you're going to like him. I think he's going to listen to you. You're going to be understood. But they still may go, isn't just a doctor. They're all the same. So this was another recent patient I saw last week who came in, and she had been dealing with chronic pain issues, seeing a pain doctor, which often are doing back injections and things, and had seen primary doctors and stuff for things going on for years. And she went to her primary. We said, well, I don't know. What do you think about this? What do you think's going on? What do you think the problem is? And she said, you just have to stop asking questions and stop looking. And we were talking, and I was hearing her story. And she said, after a few minutes we were talking, she said, do people cry a lot when they see you? And I said, yeah, a lot of times they do because they're being validated. And I said, that's sad that somebody said, stop looking. And you didn't give up. And she did have fibromyalgia. We're doing a workup and evaluation. She met the criteria. It wasn't just a localized back pain. And getting back to that complicated part, this girl who was in college, she didn't just have dysmenorrhea. She hurt everywhere. And yet, I don't want to say I hurt everywhere because I'll be perceived as, what? You look good. You look healthy. How can you hurt everywhere? And so often there's this misunderstanding. People don't get, how can you hurt everywhere when you look so good on the outside? And I had a patient who found me through my book and a little in the podcast. She read about a couple chapters. She hasn't gotten through all of it. And she said, I thought you were basically describing me in the book because, and part of why I wrote the book is I didn't have enough time to explain these complicated to patients. I used to have a 2-page handout, then I had a 20-page handout, and that wasn't enough. And I said, maybe someday I should write a book to put all of this information. And another part of this is that many people are living with chronic pain syndromes when they aren't listened to by the general medical system, often go to doctors that don't have the best evidence to support them. Often these are going down not the best science-based regimens. I do episodes on talking about like chronic Lyme, which is under the umbrella of fibromyalgia, but it's not because you have a latent infection or you don't have mold toxicity in your house and have to clean everything or some mineral imbalance, but you went to a functional medicine doctor who cared about you, listened to your story, validated that it's real, but their conclusions on the cause and the solution weren't strongly science-based. Could they have some things like talk about stress and sleep and other things? And that's often where people go. So part of why I put this out there is, so you're telling me that even though I have pain, that doesn't mean there's tissue damage, but I have just as much distress as if I do, but I don't. That's a lot to swallow because often they've been to doctors and they've tried injections and tried treatments and procedures. And when the dots are connected, often there's relief and there's grief. The relief that finally makes sense, but the grief, sometimes I think they think that they had just the worst darn luck in picking doctors and that most people know this already. And they're like, no, and sadly not, this isn't part of routine training.
That's really good. And that also fits with my experience in the sense that I will say some of those words. It could be even when I was looking through mast cell activation disorder, I think I had found that one as well and brought it to my specialist. And it was like at the time, it was like, oh, there's a lot online that's wrong about that. And it's, yes, there is, but there's also, this is actually maybe the thing, and it ended up being the thing. But yes, we need more science of those things. Like you said, there's the wrong doctors focusing on some of those issues. And I guess the other thing, to move on to the other question that works into that, is you mentioned alexithymia. And so when you're working with a patient, an autistic patient or patients with ADHD and so on, and they have trouble articulating their pain to you or what's working, what's not, how do you, I guess, change how your treatment plans and tailor your treatment plans to them?
So a couple things, what I think is really helpful. If somebody's seeing me for new, I try to get as much done in 45 minutes or in 60 minutes. I said, I want you to write down your life story starting when you were a baby. And that may seem silly. And I go, you don't remember a baby, but do you know one of the first syndromes or symptoms of invisible illnesses is colic? Now, some people remember going, yeah, mom said that I was not like my sister. I was really a difficult baby. I never wanted to go to bed. I was fussy, which is interesting because having a lifelong perspective as somebody who cares for newborns through all ages, to recognize that. And I knew there were studies getting back, how do you get these connections? Wow, colic is connected with later risk of developing migraines, later risk of having IBS. I might be the only pediatrician in the country or the world. When I have a child, a baby who has colic, I'll say, hey, mom, dad, I'm just curious, do either of you have any history of like migraines or nervous stomach or IBS or pain or fatigue, or anybody in the family tree who's ever had chronic fatigue or POTS or fibro? And now that I'm aware of this for the last several years, one of those are connected. There's studies showing up to 90% of babies who have colic, one of the parents has restless leg syndrome. So if you start to look at these patterns and these co-occurring overlapping conditions, you can start to see this. So getting back to what do I have patients do, I say, I want to know about to infancy. What were you like? And sometimes you're like, oh, I never was a good sleeper. My mom said I never slept good. I never took a nap in my life, apparently. You start to hear now, if they're 45 years old, their insomnia, but I never was a great sleeper. And what was elementary school like? What were your strengths, right? What were your strengths? What were your struggles? What physical complaints or diagnoses or visits did you have? Did you go to the school nurse? What potential social things and challenges do you have? About 50% of autistic people have been through high stress situations, and that's a nice way of saying terrible, awful things. and I want to know about it. And I mention that ahead of time. I say a lot of my patients. And I knew that there was lots of trauma associated with fibromyalgia. There's a lot of trauma associated with autistic style brains, not because they've had this. Somebody who was raped in high school and in their early adulthood, and then says to me, Dr. Lenz, I'm so gullible. And it's no, you have predators taking advantage of people who trust and read things black and white and don't know people lie and don't mean what they say. And yet still, in their 40s, may carry that forward. So what was elementary school like? What was middle school like? As autistic people have a much harder time once hormones and complex social relations, and it's not because the parents are setting up play dates anymore. What was high school like? Was there any substance use? Did you graduate high school? Did you drop out? What about college if you went? What about post? What about relationship history? And often I say it's going to be about a page per decade of your life. So if you're 60, you're seeing me, it might be 7 pages. And I don't have time to listen to the story now, but you might not be able to express it now. But I do truly want to know your story because it helps me understand you better and care for you. So being able to go home without pressure and write and type that out and either send it through my chart or medical messaging system to help understand, and they might see some patterns. I actually was diagnosed at age 37 with fibro, but I've had actually pain syndromes going back to age 7. And often when I hear actually a history is having chronic stomach issues, chronic stomach problem in a child should trigger a clinician to screen for autism. It's such a high co-occurring, and I know autism or autistic style brain, but I just use it in a neutral way. It's just a difference. But to be aware of that, it's very co-occurring, whether somebody got a formal diagnosis, but they might have said, oh, I got a lot of constipation. I was on that Miralax, or I was on a laxative or other things. Forget the original question, but how alexithymia. So having that chance to talk about it. Then the other part is, how bad is your pain? That's where using these functional scoring systems, like I use the Fibromyalgia Impact Questionnaire, is a tool, because it's not tell me how bad your pain is, but how difficult was it to sweep the floor from 0 to 10? How hard was it to sit still for 45 minutes? And when you look at these questions, you start to see an autistic person is going to have more distress with this question. How difficult is it from 0, not at all, to 10 being very difficult in the last 7 days to go grocery shopping? How do you think most autistic people answer that question?
Yeah, it's challenging.
And I had a patient I saw today, we went through it, said a 10. Almost embarrassingly, that she had to admit, as a mom, it's hard to go to the grocery store. Getting back to this, I brought up some of these things, and I'll ask a question now. It's from the book, Is It Autism? Learning, Continuing, and Growing. I'll ask a question to my patients who I have these other clues that maybe somebody's autistic. I'll say, we've been talking, just taking a history about as long as we've been talking right now, and I might say towards the end, I'm just going to ask you a question. You're going to think it's weird. You probably have never had this question asked of you, let alone by a doctor. But how uncomfortable is it for you to have sustained eye contact with people you don't know well? And it's funny because just most of my female patients who have this mask very well. And because we got a computer, I glance over, they glance over, and it works out that there's a natural pauses. And it's funny when I'll hear things like, oh, I'm sorry, is it that obvious? And I go, no, you've been masking great. But the reason I ask is some people who have these chronic pain syndromes also have an autistic style brain. Now, I don't have time to dive into this today, but I want you to go through some questionnaires, read through some things, and we can talk about it. We don't have a medicine to treat that, but we do have understand that's part of that. I said, you might not want to go grocery shopping and just order online and pull up in slot number 3C and get your groceries. Why should you have to go? I heard Walmart has some low sensory hours. We could call them autistic friendly hours, but we call them low sensory hours. And then you're like, oh, so there are things that we can do. Why should I make it higher? So if you're going to a holiday gathering, in America, we have Thanksgiving. A lot of times there's football and noise and all of this. Guys, if I'm going to go for a walk and play with the puppies outside, it's not because I'm a bitch. It's not because I'm antisocial. It's just I can only take so much, but I'd love to walk and play outside and do something outdoorsy. But if you have that, instead of being exhausted after that Thanksgiving and dreading that and getting migraines next year, the day before you go to your in-laws gatherings, and for a few days after that, you're exhausted, you're like, oh, I don't have to explain myself and don't have to put yourself in the pressure. So
super interesting. And actually, I'm just thinking of, I want you to come talk at our research institute because I'm part of the EDI group, the Super Hub there, and the Research Institute, BC Children's Hospital Research Institute. I think this is so needed. And we're talking about neurodiversity as like one of our topics and how to make work more accessible and things like that. But I also think that the doctors need to hear this because, yeah, it's so lacking and so necessary. And I think that the numbers of neurodivergent people are actually much higher than what's stated online and things like that. So I think this could be relevant for at least like a quarter of patients. Either they experience neurodiversity in themselves or in someone they love, and they're seeing these things and they don't know how to understand it.
that's where we will wrap up this week's episode. Stay tuned next week for the second half of this interview with Kristen Hovet. Also, check out her podcast, The Other Autism. Until next week, go Team Fibro.